Yeah, so Senate Bill 101 was a really interesting proposal because a lot of different states around the nation have already kind of gone down this road, and they've allowed direct primary care, which is basically like a monthly membership for primary care services. Doctors and kind of independent practitioners, they offer primary care services, and they post all the services that they offer up front on their website. And it's a lot like a Netflix subscription. So you pay $70 a month on average for unlimited access to these services. And in a lot of ways, it leads to a much higher quality of care and provider interactions. A lot of these doctors kind of pride themselves in being able to, respond to texts on the weekends and, show up at your door, do a house call like the old fashioned doctors used to do. And so it's a really a new paradigm in healthcare. And what Montana did is something that's really important because what's prevented this model from really expanding across the United States is overzealous regulators, particularly insurance regulators, who want to consider these memberships that don't have any sort of relation to insurance in terms of risk bearing or anything like that. The regulators see these DPC memberships as insurance. And so that would require them to go through all the hoops and regulations and red tape that insurance companies need to do, even though they aren't that. So that's been prohibitive in a lot of other states. And so what this law did is it said that direct arrangements and direct primary care is not insurance, shouldn't be regulated like insurance. It's a completely separate thing, and it's sanctioned under the law. So we created what's called a safe harbor. Basically the government saying that it's okay for these arrangements to exist, and they shouldn't be regulated like insurance just for existing. But the unique thing about Montana is that, with this bill, we're kind of thinking bigger beyond primary care. And we're the first state in the nation now to allow direct patient care agreements for all types of medical providers, primary care, but also mental health providers, dentists, chiropractors, even some specialists. So we're allowing kind of maximum freedom for doctors to really, medical entrepreneurs to really just implement this model and develop new ways of caring for people. And the cool thing about the model is that it bypasses a lot of that broken system that I was just talking about, the history of healthcare, because a lot of the features of that broken system is bureaucracy and all the insurance middlemen involved in order to deal with these really high costs. And with DPC, direct primary care and direct patient care, we're getting back to this free market idea of medicine, where it's willing buyers and sellers, and it's people offering a product for a specific price point.